There's 1 liter left in the dispenser to clean the second operatory. Carry it to the next room and place it in a horizontal position. Again, attach the saliva ejector and the HVE hoses to the adapters. Open the handpiece valve, and the rest of the cleaning solution will be dispensed. Disconnect the handpieces and rinse the dispenser. Leave solution in the evacuation lines for at least 1 hour or overnight. You can enhance your cleaning effectiveness if you flush the system with 2 liters of water prior to utilization of evacuation lines after the cleaning procedure.